on another episode of Recharging the Human Battery. I'm your host, Dr. Stefano Sinicropi. Glad to be back this week. Co-host Mandi, Dickey, who was solo last week, did a great job. And we are on AM 950 radio. And as always, we're fired up to talk to you guys about the state of the state. So, today we're going to do a kind of a variety episode. As I've got all kinds of thoughts about stuff that happened this last week. And so this week there was something called the Minnesota Cares event, which is basically an event put on, sponsored by some local hospital systems and just people that are in the health and wellness industry. So, I had the honor and privilege of giving a couple talks at this event, and it went great. It was amazing to see almost, I would say, probably pushing 500 people that came specifically to learn about health and wellness issues. And in kind of the position that myself and Mandi are in, usually when we get together and gather people to talk about these kinds of things, most people in the room, we have to start from square one. But yesterday was great because it was a lot of nurses and people that work in hospital systems or nursing homes. And so they were very, very receptive to the message. So specifically, what I talked about yesterday in my lectures, and they were the same lecture. I changed it up a little bit for the second group because some people kind of stayed for the second one. So just changed it up just a little bit. But I started with kind of being a little bit, I don't want to say on the dark side, but laying out a case for about 15 or 20 minutes on how bad of a situation we're in with the chronic health crisis. And I know you've heard me and Mandi talk about this ad nauseum, on the show, but the problem is until we put the fear of God or whatever you're afraid of into you, it just doesn't, it may not resonate. So this was a crowd that is okay because they already understand they're taking care of patients themselves. They see what's going on. They have family and friends. I ask questions kind of like, is anyone have perfect health or do you think, does anyone dispute the fact that we have a horrible crisis going on? And of course, not one hand, because if you really think about it, if you let it sit in, it really is a huge problem. We're spending a ton of dollars. We're throwing all this money at people, and yet we're not getting better, and that's where our system is really failing the population. And then I went on to talk about, the steps to take. We could talk about that a little bit more on the other side of the break. But, I'll leave it up to, when you talk to people, and we're talking to people right now on this radio show, what's your approach to letting them know, how bad things are? And we'll talk about more on the other side of the break. But give me your 30 seconds on, do you scare them, or do you just kind of try to gently let them know, how bad things are?
I think I take it person by person, but gentle typically doesn't work. There typically has to be a little bit of fear, not a scary amount, but just enough to make people think, because you have to understand the brevity of the situation in order to understand what you need to do about it.
No, absolutely, and that's a nice, short and succinct, right to the point answer, and it's true. It's just, I was putting up. So just come some of the. I know you. It would be nicer if you could visualize it, but one of my things was just all these graphs. I said I'm just putting up random graphs. Here's diabetes. Here's obesity. Here's dementia. The trend is not our friend. And then I put up another one, and I apologize to everyone. I'm like, I'm not trying to get people upset, but I showed a slide. It literally had donuts, a big gulp, a big value meal, and all this stuff on all these pictures of sweets and candies. And I said, this is not normal. It's not normal. We consume 130 plus pounds of sugar a year, 140 pounds of wheat, 65, 70 pounds of seed oils per person. It's not sustainable. So on the other side of the break, we'll pick that up. We're on AM 950 radio. This is Recharging the Human Battery. We'll see you in a few minutes. All right, welcome back back to Recharging the Human Battery Radio. Dr. Stefano Sinicropi, Mandi, Dickey, our esteemed nurse practitioner. With us today, we're on AM 950 radio, and we're just talking about kind of the state of the state in healthcare and the chronic disease crisis, something that we just pound away on at this show. But we're gonna look at it a little bit different. So on the other side of the break, I talked about a couple talks I gave to primarily a healthcare crowd who was looking for wellness options. And so we started with kind of the scaremongering. And again, I'm preaching to the choir. These are folks that know that. And we talked about, well, I know that, I didn't want to do a show of hands. And I was like, I don't even have to ask you guys stuff. I know that a lot of you are suffering from bad chronic diseases. Some of you are suffering from 3 or more, as are like a quarter of the population. And then how many of you in the room are just in pain right at this moment? You're hurting. Right, and what do you feel like? You feel, and these are people that have access. They know how to do the research. They know what to look for. They know what to do. But yet, a lot of them are still kind of stuck in the loop of the traditional medical system, and they're not getting the answers they want. These are people in the know. Think about the people that are out of the know, that don't even know where to go. They don't have buddies, or that they go, oh, hey, can you get me into this, or can you get me to an... They don't even know where to start. And so that's how bad things have devolved. But then I said, okay, here's the positive part of the talk. So then we went into the usual stuff, the fight. We talked about nutrition, sleep, exercise, getting into positive moods and states, basically relaxation, and then staying away from toxins. Those are kind of the big five. And then we started going into biohacking, which we've done ad nauseum on this show, and all these other like more advanced things, hormonal management and high advanced biomarkers and whatever. And then we just went through really something that is incredible, and it's easier to access. Like people coming in and having a huge panel of biomarkers, having hormonal management, their cortisol. I mean, I highly recommend that for everybody, but that is a lot more. It's more advanced. It may cost people more money. It just depends. But the protocols like we do at our Harper Church clinics is something that really is accessible to everybody. Yes, there's an investment, but it's a lot less than having kind of the elite, workups. Which again, if you can do it, it's incredible, and it may be game changing. It may pick something up or whatever. But if at least you could do the biohacking. Anyway, we went through all that. Talks went great. A lot of people afterwards were coming up asking all kinds of questions. Most of them were just kind of like as fired up as I was to just be like, this needs to change. We got to do something about it, and all this other stuff. And so it started. It really got me. Like when I do stuff like that, and I know you feel like that, I feel like so much. That is the fuel that really drives me to do this much more. When you have people coming up and say, hey, one person said, hey, I could have listened to you for another 2 hours. I was just getting started. I'm upset that this ended, and I have to go to a different lecture, right? Because we were just getting into it. We were getting going, and I had to kind of hurry up towards the end and zip through some of the stuff because, as usual, I go off on my wild tangents randomly. But that is fuel to the fire. I mean, do you feel like that? Like when you just, like, you'll have it, like, you've been doing a lot of these consults on these brain patients, right? And you know all about it. You've been an expert for a long time. You went through your own stuff, well-known saga on this show for those of you that listen every week. But when you hear these stories, and I want to talk about some stories of people investing in their health outside of the traditional system and where they are, but how does it make you feel like personally? Like, is that the fuel? Because that's my fuel. That fuels me more than everything else.
Yeah. Both when I give lectures and when I'm doing the consults on patients, that's when I get the reinforcement for why I'm doing what I'm doing. This is why I got into healthcare to begin with, was to help people to make differences, to make changes and help other people to get to the healthiest point that they can get. And when I'm doing those consults and helping clients find what they can do, how they can control their health. Again, we've said it many times. That's CEO of your own healthcare. People have more control than they realize they have. And once we get to the point where we can talk about how they've exhausted all the efforts up to that point of what they can do now, and you have control, you can do this, this, X, Y, and Z, and let's do it. This is your plan. And when we come up with a plan, it's exciting, and that's what ignites me. And same thing doing lectures. When people come up afterwards and thank you, or they found that aha moment, and just seeing those light bulbs go off. Whether it was when I was a nursing professor and having students come up afterwards and having those light bulbs go off, or when you're giving a lecture to other healthcare professionals, you see that excitement in somebody else. You pass that spark on. Yes. And that's exactly why we got into doing what we're doing. And that's in my dark moments of my journey of recovery, when I feel like I'm not doing anything good, and something like that happens, and I can do a consult and feel like I'm back to myself again. That's amazing.
No, that's no, I know, and I see. That's why I thought that was a thing that we share in common, and why we're sitting here doing the radio show. Right, it's a Friday morning. There's plenty of other things we could be doing, but I honestly rather not be doing anything rather than trying to communicate and break through, on the things I know. So it was interesting. So getting into the kind of the next variety show, deal, and we'll just kind of stick kind of on the same topic, but coming out of that. So I talked about the usual stuff. Making analogies between one thing and another. I talked about kind of the photosynthesis and the photobiomodulation and how exciting it is. But how exciting it is that things like light and oxygen and all these things can make cellular changes. And it's not because we're like being hopeful, or we just want it to be like that, or we want to just tell people fairy tales. It's because it's hardcore science, and we could parade article after article showing this stuff. And one of the points that I made, and I don't know if I did it in both lectures, I might have, but one of the points that I made is my frustration is when these new things that I've learned over the last couple of years, and I've made myself an expert on and talk about all the time, when I try to pass this on to a crowd like that and they're excited, it fires me up. But what the opposite things that happens is when I talk to people and I tell them about things to other providers that may be so dramatic to their patients with such little downside, such little risk, and they're just looking at me with like disinterested. I can't even explain how annoyed I become by that. Understand, if a patient doesn't want to hear the things, right, or in the wellness center, we'll call them clients in the wellness center, that's one thing, because they don't know. They didn't take an oath to heal people. But when a colleague is talking to you and saying, hey, we have these things, and I'm not just telling you stuff because I just want to give you fluff and make you happy and, unicorns and rainbows. I'm telling you stuff because this is stuff now I've spent 2 years really passionately studying, and I'm trying to pass it on to you. I'm like, here's research at Harvard, here's the research at University of Arizona, and they're just looking at me totally disinterested. How annoying does that get you? I don't mean like the people. I mean like the people that should be excited that are completely disinterested. It's such a problem right now, the apathy that we're finding in medicine. I'm sorry. Yeah. I just have to call it like it is. Yeah, there's a lot of amazing people. They're excited. They're doing kinds of stuff. But there's this low-level apathy, which is I want to just root that out. I want the government to make me the czar of getting rid of apathy in medicine, because I think that would be my calling.
Can I second that motion right there?
I'll let you go.
I'm going to second that, right? Yeah, let's do that. It's so frustrating. Even when I was doing consults in the hospital, if I would try to bring something up to one of the primary doctors, and they're like, nah, I don't think so. I'm like, then why did you even ask for the consult? Like, seriously? This is my specialty, and you're not going to take my advice. Okay, whatever. It's frustrating when you can't even get your colleagues to try to get on board with something, even when it's not typically outside the box. But when we're now thinking of complementary therapies, it's really frustrating, because it's there. There's plenty of research on it. It's just not something that they've read.
Yeah, and again, the frustrating part is, it's one thing if I'm just sitting there and I get into a debate with them about whatever, and I'm just saying stuff off the top of my head. But if I send you 10 articles on it and tell you to read it, and then you have no interest, or you don't even open them, you don't even, again, right? And then again, I was in the same position. I always tell the story about how long it took me to look into these things, but whatever. It's just, that was a whole different situation. But when they won't even open it, or they do read it and they're still not interested, I'm like, why are you doing this? Mm-hmm. I understand that doesn't fit into the box, but our job is really to think about different ways, because as we've talked about on this show, our ability to touch people's lives when they see us, we can put something in their head, and it may have nothing to do with our specialty. It may have nothing, but if we are knowledgeable on that, we can say, you know what, you don't really need my help. But you know what you do need? You need to see a clinical therapist, because you have a lot of trapped emotions or whatever. And I wouldn't have known any of this stuff until I talked to world-renowned psychologists and psychiatrists about this stuff, and now I understand. Mm-hmm. So now I get it. But if I sit around with some of my colleagues talking to them about trapped emotions and how that's making their back pain worse, I mean, they probably would spit out their drink if they're drinking something, right? They would just start – there's a lot of memes on that stuff. Everything would just start spitting out. And I'm just like, what is important to – right? Like what is important to you? Just doing like this little narrow silo, going about your business, and everything else is – it's not your business. I'm sorry, it's your business. You took an oath. It's your frickin' business.
I think part of it is the good and bad. We all have continuing education that we have to do to keep up our license, but there's nothing saying what we have to do for that continuing education. So people choose what they want to do. They choose things that they're comfortable with, that they know. They don't choose to look outside their normal comfort zone to read things that they don't know as much about. If they did that, I would see that more as actual continuing education. Because you're continuing to learn. You're learning something that you haven't learned before. You're not relearning the same thing over and over. You're learning something new. That's where I think people need to expand. Learn something new that's going to expand on your practice, not something that's just going to replicate the same thing you've already done a million times.
That's exactly right. And I always talk about that. And now, I mean, you just made me go on another, so I'm the co-chair of the spine division at the Society for Brain Mapping. And so we're bringing in some speakers to talk about traditional spinal stuff, total disc replacement, different approaches to the spine, operating on morbidly obese patients. I've got some really good, actually one of our vascular surgeons from Alina is going to join us and talk about really how we approach these very challenging patients that just need an anterior approach because it's better for them. But what the decision, and I'm so excited that organization has embraced my ideas of thinking outside the box and really embraced it hardcore, because we're going to be doing photobiomodulation, we're doing virtual reality learning for surgeons and healthcare providers on how to be better and how to avoid making mistakes and getting into positions where your emotions basically control you and you lose control of the situation. It's a kind of a biofeedback virtual reality thing that there's this company that's doing. It's really fascinating stuff. That's the kind of stuff. I get it. So my point is exactly what you said. Yes, I want to bring in experts because there's going to be neurosurgeons there and orthopedic spine surgeons and neurologists and all kinds of med students and all it's a very multidisciplinary group. And so, yes, I want them to understand, kind of the hardcore stuff that we do and be the best and get tips and tricks because you want to be great at what you do. On the other hand, though, expanding their knowledge. We have another talk, for example, on the Neuro 20 suit, which is a rehab suit for people that have spasticity, that are post-stroke, all these other things. I can tell you 99% of that audience, when they look at some of these talks in the virtual reality, they have never heard of this stuff before. And hopefully it expands. That's what we need to be doing because I can tell you, and again, it's not whatever. Yes, I've spent the first, 17 plus years of my career. I'll just say that, and I'll divide it. I've been 19, really trying to master everything that I do ad nauseum, like every single procedure. But then the last 2 years, adding in stuff I never even thought about one time. For 17 years. But I have absolutely noticed that now when I consult with patients, having that ability to talk about things way outside of the box has sent people down directions, again, have nothing to do with me operating on them, even anything to do with spine, but might have put that patient on a completely new path that has changed their life. And that's true. That's just on. That's not because I didn't like master anything new. I mean, I didn't become, I didn't like learn another specialty, go back to school and get a degree. I just know enough about things saying, oh, you have spasticity? Oh my God, there's these people doing this amazing research. You should go and we'll connect you with that team. That can change. Because if we're not doing it, where in the world are they going to get this? Where are they going to get this information from? I have no idea. I mean, do you agree? I mean, I know that you've done that many times with patients. Sent them like they had no idea, especially with the brain stuff. They didn't know. They went to you and they're like, oh.
Yeah.
Right?
And even more so now that I've been through my own experience, I've learned about other different therapies that I didn't know about before. Right. And I thought I knew a lot as a provider, and now I know more. But it's when I used to go to the International Stroke Conference every year, and every year it was the same information. I'm like, teach me something new. I need something new to bring back to my patients. And that's what I was always looking for. So I ended up having to educate myself on it. And if we could have more conferences like that where we can educate other providers on these new things and you can learn about it, go with an open mind, learn about these new therapies, and then send your patients so that they can get a better overall care.
Exactly, especially if you understand. I mean, again, I'm not advising people to learn crazy stuff and learn about all kinds of experimental drugs that are being done in other countries and go there that have horrible side effect profiles. I'm talking about safe alternative things that people can do outside. It's just dramatic or not, or just you just have to have a much broader. So I think we need to really broaden education, even in residency programs. There was an idea floated by actually the head of the Brain Mapping Society, kind of like threw it my way, and I said, well, I got a little bit on my plate, but developing a comprehensive spine fellowship where you learn about you're talking about like electromagnetic stimulation, photobiomodulation therapies, all kinds of post-spinal cord injury treatments, stem cell therapy, on and on and on, outside of the normal surgical thing, because that makes you such a better doctor. And again, I feel like I have become such a better, obviously, learning about light therapy hasn't made me a better surgeon. I mean, that's what I worked on for so long, but it's made me a better healer and physician, because ultimately, what are we trying to do? We're trying to get people to where they want to be. There's more than one route. There's more than spine surgery or injections and all these other, things that we do to people. So that being said, so after I did my 2 lectures yesterday, and then, had to do the whole, talking to everybody, people that had questions and kind of walking around and doing the usual things we do. Then I did a podcast with, our new director of regenerative medicine, who I've known forever. He used to be a partner at Midwest Spine, Dr. Louis Sager. I mean, he's a renowned injection specialist, honestly, one of the best in the United States. I mean, you want somebody that can do precision medicine. There's really nobody better, and I've used him for so long, for my patients. And it's great that now he's kind of, we got the gang back together, and he's back with us. But his new thing, really, for the last several years, he has become, a guy that's at the forefront of regenerative medicine, which is where the synergies were, because we're doing things outside the box. So I had a 2-hour great podcast with him talking about where regenerative medicine fits in the continuum of care for all kinds of things. He's been an expert in spine, but he does everything, every joint in the body and all this other stuff, and he can do aesthetics and sexual health and all kinds of regenerative medicine procedures. But the point of it was we got into this conversation that we're in now. And here is a guy that has been in practice for 3 decades and has totally thought outside the box, remade his career becoming a regenerative medicine expert, has people flying in from all over the country to have these incredible procedures that he's doing. And I talked to a guy like this. He couldn't be more excited. He could not be more excited, like a kid in a candy shop, right? And as we talked about before, I had to wind it down towards the end because we're at like 2 hours plus. And I said, well, for the sake of the audience at this point, we're getting to that point where let's pick it up. We'll do a part 2, whatever. But the point being that one of the ways that we wrapped it up was two things. One, we commented on how the apathy, it's bothersome. I mean, he's bothered by it too. Again, here's a guy 3 decades in practice, and he sees it, and people don't want to learn new things. And regenerative medicine is incredible. What they can do with mesenchymal cells and PRP, plasma-rich protein, all this stuff is incredible. It's like, and we went through these case studies. I mean, an old lady that had a shoulder problem and knees, literally 99% improved from a regenerative medicine protocol. And then we talked about another guy with this horrible knee stuff, and we talked about some studies, some like longitudinal studies that were done over 20, 30 years. People have been doing some of this stuff for a long time with the patients their own control. Like they only did one knee regenerative medicine, the other knee had surgery, and the patients prefer the knee that had the regenerative medicine because it survived. They didn't have surgery. It's amazing. You're your own control, so you can't run away from yourself. You are who you are. So it's just these amazing studies. And so that was it. So we kind of expressed that frustration, and I started asking, like, what is going on? Like, what is wrong with our system? We're spending all this money. We're not, all the stuff I talk about all the time. And we're not getting anywhere. So that's why we have to take it outside of the traditional system. And it's amazing to have people like you and Dr. Sager and all these people that are, it's like a fly trap, like, right? It's like, it's bees to honey right now. I mean, they're just they're flooding in. And they're just like, I want to be part of this. We have Dan Zeman, who's moving from Arizona to be part of this because he's like, oh, my God, this is what I've been waiting for my entire career. I've been waiting for people to really do this, but go big. Like say, we're going to make a drastic change. So this comes to the, what we can talk about kind of for the remainder of our time. The frustration with the brainwashing of minds, and that was this. And we've touched on it a little bit. I did a whole entire episode on the insurance industry and teach, and prescribing to the insurance, and I think we've talked about it. But when we talk about hacking of the American mind in every other thing, people are willing to invest. They invest in the stock market. They invest in whatever. They invest in those tickets to go to a Twins game, which might cost them $600 for a family of 4 or more. Or more, depending on where they sit and how many hot dogs they want to scarf down, and 100-ounce drinks that the American public just loves. I'm sorry, I don't mean to. I have to throw it in there a little bit. But they're willing to invest in anything. They invest in vehicles. They buy boats. They get stuff. And I'm not saying everyone, because there's a lot of people that can't invest in anything. They don't have money. But overall, people spend money on all kinds of things. How many apps do we have on our phone? Some people have so many apps on their phone, they're spending $500 a month for stuff they like literally, if they would be better without it. A lot better, actually. And so we got into this whole discussion about people investing in their own care. And yes, we are all frustrated that CMS, that's the Medicare and Medicare, the people that make those decisions, for those of you that are not, familiar. It's basically Centers for Medicare and Medicaid services. And yes, we're all frustrated because these things should be covered, and preventative care and wellness care should be absolutely focused on. And we need to redirect so many of the funds and dollars that we're putting in and wasting, frankly, because the bureaucracy has gotten crazy in corporate medicine. We should be putting that towards wellness care, and we would reduce our costs dramatically and make people a lot happier. Okay. But that's not what's happening. Okay, that's not reality. Me and Mandi, we can only deal in reality. We don't sit in Congress. We don't have a vote. We can't change things on that. We can lobby. We can do things. We can jump up and down, but we can't make that change. So that being said, here's the frustration. Many of you are trapped, and I see it. I talk to you every single day. You're trapped in a loop of getting sicker. You're trapped in a system that is not, some of you, it saved your life. But many of you are trapped in this. You don't feel well. You're not good. Your chronic illness is getting worse. But yet, even when you have the means, you are so obsessed because you've been well brainwashed on this stuff. It's just true. I'm just being honest. That everything has to be paid for because it's your right to get it. And listen, I'm all for it. I'm all for all these things being available to all Americans. We're doing well. Our economy is actually doing pretty all that stuff, right? So don't get it like I don't want people to have paid care. That's absolutely not true. But that's not the reality. Why would you sabotage yourself if the things that are most beneficial to you are unfortunately outside of the system? Some people just don't have the means, and that's why at our clinics we are doing hardship, assistance to people that really need it. I mean, it's a whole strategy that we are developing because we want people to get the care. But for people that, I mean, we're talking, in the hundreds of dollars. This is not like, kind of a month to change your life potentially, but yet you don't want to come out of it. And then Dr. Sager, of course, goes on a tirade about it because same thing with regenerative medicine. Why would you not want to come out of the traditional system when maybe it can save you getting that total joint or having major surgery, maybe for a decade, maybe longer, maybe it won't. I don't, we'll leave that up. I mean, every patient's going to respond differently. And again, this is not medical advice, but it's very frustrating that, number one, the providers, and we've talked about ad nauseum, providers are just giving people options that are covered by insurance, even if they know other stuff. They're not even telling them about other things. Okay, but then when and that we're not going to talk about that. That's a whole other discussion. But when it comes to the patients, even with understanding, here's the research, here's the data, here's patient testimonials, here are 5 other providers saying, yes, this would be an amazing option for you. But their absolute insistence, and I mean people that have means, their unwillingness to make the investment. Okay, and let me just finish this thought, and I'll get to your thought. So, unwilling to make the investment in their own care, and again, becoming the CEO of your own health sometimes involves making investments in your own care. And there are people that they'll believe in like over the counter supplements, and they'll be spending $500 a month on over the counter supplements that may not even have any concrete clinical research behind them. But then we have other modalities, and they don't want to do it because those companies have done a better job, and they're on the radio every 5 minutes telling you that if you take this one supplement, all of a sudden your memory is going to come back. Okay, and you know what I'm talking about because that's constant. But meanwhile, there's, and again, those are those are sponsored by the company, those stuff. But there's other studies that are done in world-class institutions, for example, using light therapy that actually shows improvement in cognition. But yet people, I can't invest in that because we don't have enough commercials. I don't know. I don't know. But the bottom line is, then we went into kind of case studies of people, and we did 2 things, and then I'll let you have the floor. One, we talked about his patient, that 79-year-old lady, and we talked about the fact that first she was a little resistant to making the investment. She made the investment, and it literally, she almost couldn't walk from her knees, and then she couldn't comb her hair from her shoulder, and now she's great. What is that worth to her? The lady's ecstatic. And then I talked about a case which I want to talk about more and other things of this guy. Might have mentioned it actually a couple weeks ago. I don't remember, but it was a guy that I saw that clearly had a horrible concussion, totally mismanaged. Guy was at his absolute wit's end. And my entire discussion was, because he's like, man, I've been out of work as a UPS driver for 9 months. I don't know how I'm going to pay for this stuff. He made it, but after discussing it with him, the guy was like, literally, he's like, I don't know if I want to live like, I can't think, I can't talk. The guy was stuttering. He was talking so slow. I was having trouble, like, even getting through the thing because he was, like, so slow. So finally, after talking to him, he's like, you know what? I'm just going to do it. He's like, I can't. He's like, I can't do this anymore. My life is ruined. He had his first treatment on his brain, and I know you had a similar, thing. And again, we're doing this off-label, and people are, we tell everybody, what we're doing and what the studies are and what they're doing at Harvard and all this other stuff. Anyway, he had one treatment, and he made everyone in the clinic cry because he was he was tearing, and he's like, this is the first time I could speak coherently in 9 months. He was talking, so he didn't want to stop talking. He didn't even know what to do. It's as if like the shackles were taken off, and he's been our client now for several weeks. He's doing very well. I mean, he's the normal ups and downs, but he's way better than he was. And I have to operate on, I have to do a surgery on him because he does have a serious problem that we need to deal with. But we're trying to get his brain better before he undergoes anesthesia. But these are two examples of people that have made the decision to invest in their own health. And maybe say, well, you know what? Maybe I'm not going to have that Starbucks latte every day that's $7 and is also killing me, by the way. That's a whole – again, sorry, I told you I was going to get a couple digs in here. I can't help it. I'm still on this kick from my lectures yesterday. And maybe you don't want to take on that other $700 a month car payment that you don't need because you have a nice functioning car. And again, I'm not telling you where to spend your money, but I'm saying your health is your wealth. You need to invest in that. What is the long-term cost of not investing in your own health? You think it's a big bill of getting some alternative care. It's not even alternative, by the way. I hate that word. It really should be standard of care, and we're going to make it standard of care. That's what we're doing. But spending money outside your traditional medical system, you think that's a big bill? Wait till you see the bill for not getting some of this care 5 years from now, maybe a year from now, maybe 5 years from now. Wait till you see that bill. Could be devastating. You could be out of work. You could be on pain medicines. You could have fractured relationships, all kinds of stuff. So you could. Can you? I'll let you have the floor for the final 3 minutes that we have here, and you could talk about kind of all these things that I just laid out. And I mean, people just need to invest in themselves.
Yeah, a couple different thoughts on that. So I used to be a health and fitness coach, and the company that I worked for, we had a protein shake that we recommended to people, and people would always come in and say, well, what's in it? And they would pick it to pieces. Well, I don't know. I don't really know that I want to do that. But meanwhile, they're eating McDonald's. And so, so like you don't ask what's in that McDonald's deep fryer, but you're going to ask what's in the protein shake. Okay. But so I totally get that part. It drove me bonkers when I was doing that. But as I'm doing these consults with clients as they come in, and we talk about the cost. Yes, there is a cost, and it's outside the traditional medical system, but it is putting an investment in your health. We talk about think about your car. You do maintenance on your car, right? You do your regular maintenance, and it prevents you from having a major meltdown with your car. And when that car goes awry, it's going to be very expensive to fix. Even when you have health insurance, and we're finding now that the health insurance is not what it used to be. So even those of us working in healthcare do not have Cadillac insurance plans. So we don't have the same health insurance coverage that we did 20 years ago. It's not the same. So having health insurance does not ensure that everything's going to get covered, even if it's covered, quote, by insurance. So you still might get stuck with a big bill after having surgery that still may or may not work. Sorry, I know you're a surgeon sitting right across from me. But surgery may or may not fix the problem.
I tell them that you're preaching to the choir.
So surgery may or may not fix the problem, and you may still get stuck with a big bill after your insurance quote covers it. So you could consider other options that have been shown to prove effective. When I finally got into Hypercharge to do my therapies, it had been 6 months after my accident. I was doing the traditional treatments, PT, OT, hadn't gotten into speech yet, but 6 months, I hadn't seen any differences whatsoever. And that first day, I was in tears because I hadn't been able to string together a full sentence. There's no way that we could have done this radio show because I could not stay focused to have a conversation, much less have a full sentence come out of my mouth and have it be coherent. So that wasn't a thing. And I made my 15-year-old child laugh and smirk at me that night and say, welcome back, because I was talking his ear off, driving him to and from swim lessons. Like, I hadn't talked in 6 months because I didn't like the way I talked. So I totally get that feeling of not being able to speak and then all of a sudden being able to. So when I'm sitting with clients, having those conversations about what can you get out of this? No, we can't make any guarantee. No medical system can give you a guarantee, but I can tell you what my experience was, and I can tell you what the experience of several other people have been, and yeah, we can talk about it more after the break.
So yeah, that's awesome, and I want to share. You just hit on something that's really important, and I don't know if you made the people tear up as much as this guy did, but we'll find out because I'm gonna ask them. So we'll see you on the other side of the break. We're on AM 950 radio. This is Recharging the Human Battery. I'm Dr. Sinicropi, joined by Mandi, Dickey, and we'll see you in a minute. Time is getting slim here on Recharging the Human Battery Radio. I'm Dr. Stefano Sinicropi, joined by Mandi, Dickey, our nurse practitioner, and we are on AM 950 Radio. And this has been a great discussion. I mean, I've really enjoyed this. I always love sitting down with Mandi doing these because we just share these ideas, and it's just interesting, and we're just trying to get this information out to the public. One of the things you brought up was the kind of the Cadillac plan and getting bills, and there's also, when we talk about the brainwashing, one of the things that came up yesterday is I had a friend here in town, and she had a horrific migraine, and she was supposed to come to this event and and check it out because a wellness event, and she's into wellness. She had flown in. And she texted me and said, I have this horrific migraine. I'm vomiting. She had the aura. And she's like, she was like, I'm thinking about going to the urgent care room and getting some meds. Should I try to come to the clinic and get some modalities? And I said, absolutely. And she's like, well, what should I do? So I just gave her I said, get in the green light. Just do the green light alone, which has been shown at University of Arizona to be incredible for migraine headache, and then the transcranial laser. She went from a 10 out of 10, nausea, vomiting, all this stuff, to having no migraine, coming to the event, bouncing around the whole time, and she actually did a post on her social media talking about her experience. She's like, this is crazy, but the reason I bring that up is because people, for example, for migraine, and I mean people that know it's migraine. I don't want people that are having, an aneurysm to go, like, you don't want to come get light therapy, obviously, if you've never experienced anything like that. Again, this isn't medical advice, but if you're a chronic migraine sufferer, some of these therapies are very powerful. With data behind them. I mean, I urge you to look at the University of Arizona study with green light. It's incredible. We use it all the time for migraine and headache with amazing, results. Again, none of these things are guaranteed, not medical advice, but I see what I see. And so that brings up, the point that you made, and we could wrap it up here. People don't have these Cadillac plans. They don't realize, yes, maybe they're not, pulling out their credit card when they're there at the urgent care center. Right? My kid had a piece of glass taken out of his foot, and the bill was $1,400, and we have insurance. Mm-hmm. A piece of glass out of his foot. And I said to my wife, I'm a surgeon. It's a piece of glass in the foot. Not that we can't afford it, but come on. Yeah. So, you bring up a great point. How have people are obsessed with going and getting this high-level care for things that can be treated with other measures?
Yeah, there are so many other things that can be considered that people may or may not know about. I mean, I had been hearing about these different therapies on podcasts for 10 years. I just didn't have a place to go. And now that we're here, come check us out because, my goodness, I can't say it enough times to people. It's another option. And, you might have to pay for it, but you're probably going to have to pay for the other stuff too. Just wait for the bill to come. You're going to have to pay one way or another. But why not pay for something that might make you feel better without the side effects?
Absolutely. But not only that, it's just our goal, our goal collectively, as a group. I don't even want to say it's our organization. Forget Hypercharge. Just this larger group of providers that we're putting together under this umbrella that want to do want people to live their best lives and want people. I'm not saying that there's people that don't want you to live their best lives, but they just may not know. Mm-hmm. They don't know, or they're apathetic, or they're just burnt out. They're just like, I don't know. I just do what I do. I'm just going to prescribe you medicine and let's move on. But just putting together these people. So I think it goes a lot bigger than that. And there's all these different ideas. I think here, we can finish it here. At least consider looking into these other things. Get a consultation, whether it be from our clinic, Hypercharge, or go to other, provide naturopaths or functional medicine doctors or people that think like we do. We're all in this together. It's not just about promoting our own thing. It's really, it's really has to be a global effort to make a difference. Unfortunately, our time is up. This has been amazing. We'll see you next time on Recharging the Human Battery Radio here on AM 950. Dr. Sinicropi, Mandi, Dickey, and we are out.